Well, welcome everyone. We're so excited. We're going to get started in just a few minutes, but thought we'd go ahead and open up the room so that we could welcome you. We'd also love to introduce yourselves in the chat. You can share your name, your role in program, what state you're from, and then would love to know if you had an afternoon free, which one of these would you prefer to do? So you can just pop in the number, or if there's something else entirely you'd rather do, please feel free to pop that in the chat as well. And we'll just spend a couple minutes here while we wait for a few more folks to pop on, and then we'll get started. Welcome, Kenneth. Kenneth, you want to let us know which one of these activities you might like to do if you had the whole afternoon free? Oh, Sarah, who's joining us from the CDC. We're so excited. She's going to talk in just a little bit. Says she'd do number 2. Same, Sarah. I would definitely do number 2. Although number 4 looks great also. Hey, Kristen, we've got some number 5s. Linda, number 1. Awesome. Well, feel free to keep them coming. Thanks, Kenneth. Hey, Wanda. Awesome. Oh, good. We've got lots of folks popping in the chat now. Well, welcome. We're going to give it maybe just one more minute as we get everybody on and going. And while we're getting started, would love to have you introduce yourself in the chat and just share if you had an afternoon free, which one of these would you do? Or if you wouldn't choose one of these, tell us in the chat what you'd rather be doing. And feel free to keep the chat going. We are hoping that the chat will be very engaged throughout this whole webinar. And so as I transition us to really get started, feel free to keep chatting. Tell us how the weather is where you are. Tell us what you love about your job. Just pop on and say hello. Feel free. And then there's going to be lots of opportunities throughout the webinar to engage as well. But I am going to go ahead and get us started. We're going to start with just a little bit of housekeeping. Just want to make sure folks know that you can view closed captions on this webinar. We're going to try as much as possible to provide descriptions and summaries of what's happening in the chat and what's happening on the slides. You will be able to get the follow-up materials, including the recording and copies of the presentation after this webinar. We definitely want you to feel free to jump in and use the chat. Also, feel free to unmute. There'll be some specific opportunities. We'd love you to do that where you can ask questions or respond to activities, but also just want you to feel free to unmute, ask your questions, be engaged, but stay muted when not speaking just because it helps cut down on background noise. I want to welcome everyone to this afternoon's webinar. My name is Claire Grace Jones. I go by Claire Grace. I work for the Collaborative for Advancing Health Equity and Out of School Time. And if you are here for our Promoting Lifelong Benefits for Youth Through Out of School Time webinar, you are in the right place. I wanted to just start by telling you a little bit about our collaborative. The Collaborative for Advancing Health Equity and Out of School Time is a partnership between the Education Development Center and the National After-School Association. We couldn't do this work without the support of our amazing funders and partners at the Centers for Disease Control and Prevention. Together as a collaborative, we're working to ensure that all youth have a fair and just opportunity to be as healthy as possible. Just a quick peek at today's packed agenda. We are so excited to have so many people contributing to this next little while that we're going to get to spend together. We have an open and welcome from Natalie and Sarah from the CDC. We're going to do a little bit of talking to just set some context about protective factors as a health equity strategy. And then so excited to have Ken Anthony and Heather Ashley Williams to share the impact of partnerships on increasing protective factors and really share their experience from the field. And then we'll do an activity to bring it all together and share some additional resources and closing. And these quotes actually came from a resource that was created by Ken and Heather, and they just really spoke to me as I was pulling things together for this webinar, just really thinking about how important increasing protective factors is and the importance of caring, trusting relationships. And just a short amount of context setting as we get started here. We weren't sure. Actually, I'd love if you want to share in the chat. So if you throw out a yes if you're already familiar with this concept of risk and protective factors, a no if you have no idea, or a maybe, let us know in the chat kind of where you fall in how new this feels for you. But I wanted to just provide a brief overview as we get started. When we think about risk and protective factors, I think what is important to me is knowing that they're research-based. They exist across multiple contexts. So we're not just talking about something specifically to this one individual child or person. They can be biological, they can have to do with the family, with the community, with the environment. Some risk and protective factors are not changeable. It might have to do with something genetic. It might have to do with, some internal factor that is just not able to be changed. But some of them are changeable when you think about the way that a family functions and communicates that surrounds that child. You think about the environment around them. There absolutely are things that are changeable. We know that they're correlated and they're cumulative. And so when we think of risk factors as characteristics that are associated with a higher likelihood of negative outcomes, and protective factors being characteristics associated with likely that there will be fewer negative outcomes. So we think about things like substance use or mental health challenges or things like that. We know that the more risk factors someone tends to have, the more likely they are to have even more. And that young people with multiple risk factors have a greater likelihood of developing a condition that impacts their physical or mental health. But then we also know that young people with multiple protective factors are then at reduced risk for those things. I really like to think of risk and protective factors as a scale, and the more we can keep piling on those protective factors, the more likely we are to tip that balance, especially for our young people. It's really important to know that many risk and protective factors are not a result of the choices of an individual person makes, but related to things like genetics, family, life circumstances, and other aspects that certain populations, including adolescents, LGBTQ populations, and some racial and ethnic populations, are at increased risk to experience things like substance use, mental illness, and suicide. But we know that some of the shared risk factors for substance use and misuse, mental illness, and suicide include adverse childhood events, lack of parental supervision, family history of mental illness, substance use, suicidal behavior, and bullying. But again, conversely, as we are going to talk today about tipping that scale, we know that shared protective factors include things like strong familial, peer, and family connections. And so we're really excited to present this very strengths-based approach today to how all of you as out-of-school time professionals can increase protective factors in your spaces. So now I am going to, whoops, oh gosh, what just happened? Sorry. And now I'm going to hand it over to Natalie and Sarah from the CDC.
Great. Thank you so much, Claire Grace. Hi, everyone. My name is Natalie Wilkins. I'm a health scientist in the Division of Adolescent and School Health and lead our research translation and dissemination team. And I'll pass it over to Sarah to introduce herself.
Sure. Hi, I'm Sarah Sliwa. I work with Natalie in the Division of Adolescent and School Health. I'm on a different team. I'm on the Research Synthesis and Applications team, and I lead our work related to out-of-school times.
So we're so glad to be here with you all today and to share just a little overview of some of the work we do here in DASH to help support and promote school connectedness in particular as one key protective factor, as Claire Grace mentioned, that schools have a role in supporting to really benefit a range of different health outcomes and behaviors for children and young people. So just to sort of lay the groundwork here, we know that social connection is really critical and important. We've known this for quite a while in the literature looking at young people and in school-based settings. But more recently, in the past year or so, the U.S. Surgeon General released a pretty comprehensive report giving an overview of the research to date on the importance of connectedness, in particular, looking at the research that has linked social isolation and loneliness to a number of different health outcomes. We've known for a while that loneliness, that sort of subjective feeling of feeling like you're alone or that you don't belong, not feeling connected, has been linked with mental health outcomes, suicide-related outcomes. But one of the really, I think, important aspects of the Surgeon General's report that was less well known in the field more broadly is that objective experience of being less connected. So having fewer social ties, having fewer experiences in social settings and in both in community-based and within school-based settings, that more objective sense of isolation and lack of connectedness has been linked to a number of different chronic disease outcomes, including things like diabetes, heart disease, stroke, and has been associated with relative risks that are similar to those of smoking. A substantial portion of cigarettes a day. I can't remember the exact number, but it was something like close to a pack of cigarettes a day. And so it's been really critical. We've learned through the recent research literature, both with adult populations as well as with youth and young adult populations, that social connectedness is a really critical protective factor that is linked to a number of different health and behavioral related outcomes. So if we go to the next slide, one of the more recent papers that we published here out of DASH, we were lucky enough to be able to get school connectedness added to our national youth risk behavior surveillance system. So we have one item that's added on there that allows us to get national level estimates of connectedness for 9th to 12th graders. And in this first iteration, or this first year of collecting this data, we found that 61% of 9th to 12th graders reported that they felt close to people at school. So the good news is that's over half of all high schoolers reporting that they feel close to people at school. Another bit of good news is that we found that of those students who were reporting that they felt close to people at school, they had better outcomes across a range of outcomes, including mental health and suicide-related outcomes, sexual health-related outcomes and behaviors, substance use-related outcomes, as well as violence-related outcomes. So it does, our data at this national level does correspond and sort of corroborate what we've heard to date about the protective effects of school connectedness. That's all the good news. The bad news is that if you look at these numbers, almost 40% of young people are still reporting that they don't feel close to those at school. And if we go to the next slide, you can see that there are also disparities in terms of who reports feeling more connected at school versus those who don't report feeling as connected. Again, the good news here is that even when we break this down by sex, race, ethnicity, and sexual identity, over half of students across those different strata are reporting that they feel connected at school, but you can see that there are disparities here. So boys are reporting feeling more connected than girls. By race ethnicity, you can see that Asian youth and white youth report feeling more connected than youth of other racial and ethnic backgrounds. And then heterosexual youth are reporting feeling more connected than their LGBTQ plus peers. So again, like when we think about this from an equity perspective, it's really critical and important in all of the connectedness promoting work that we're doing, both within school time and in out of school time, that we're thinking in particular about those youth who may be experiencing disproportionate marginalization, and how do we ensure that our school connectedness focused programming, policies, services are really attending to the needs and centering the needs of those students who may be at higher risk for feeling disconnected. So if we go on to the next slide, you can see these are the sort of big buckets of protective factors that we focus on with our funded partners here in DASH. The first is family engagement and positive parenting. This is really focusing more on those sort of family connections, right? Youth feel more connected to their parents and families when families are engaged in schools, when parents know their teachers, when we're sort of helping parents promote positive communication, especially with their adolescents and young people. Healthy, safe, and supportive school environments. That includes school nutrition programs, physical activity in schools, as well as inclusivity programs and policies. And then community engagement, linking community-based organizations and folks in the community with school-based settings, again, helps to develop that sense of connectedness beyond just the school walls. And that is something that I know you all are very familiar with from the out of school time perspective, but also within school time as well. And then finally, school connectedness. I think there's some animation here. If we click one time, yeah, look at that. School connectedness is one of the key protective factors that we focus on and support our funded partners at the district and state level in promoting. And, you know, one of the questions that we got from folks was, okay, so we know that there are things like gay straight alliance clubs or genders and sexuality alliance clubs that we can set up that really sort of creates that healthy environment and is shown to increase school connectedness, not just for our LGBTQ youth, but also their heterosexual peers. But what are some of the other, you know, really strongly evidence-based ways that we can promote school connectedness in our school-based settings? And so one of the things that we did is we recently did a literature review looking at classroom management strategies and skills that have been linked in the research to promoting sense of belonging and school connectedness among youth. And while the majority of that research is really based on in-school time, what we found is that a lot of the skills that came up through that can really apply to out of school time as well, because they're really focused on forging strong relationships and building strong relationships between students and adults in their lives and within those school-based settings. So if we go to the next slide here, you can see here's a QR code for the web-based resource that we developed that shares the findings from that review of the evidence that we did, looking at those evidence-based skills that teachers or adults in the school-based settings can have that have been linked to increases in school connectedness. And I'm going to go ahead and share my screen just to take us to this website that is shared there in the QR code, just to give a really brief demonstration of what's included in this web page and where you can find it. So you can, again, go to that QR code, or if you search for CDC classroom management, it'll typically come up as one of the top hits in most browsers. But you can see here, this is what the homepage looks like. We provide just sort of a general overview on what school connectedness is, what classroom management is. And you can see here, there are 6 evidence-based approaches to classroom management, or, you know, developing environments where students feel as though they belong and are connected. And these are the 6 approaches: teacher caring and support, peer connection and support, student autonomy and empowerment, management of classroom social dynamics, teacher expectations, and behavior management. We don't have time to go through all of these right now, but I'll show just one example here. If we go to the teacher caring and support section, you can see here there's sort of just an overview of what this particular approach means and what the evidence has shown. And then there are these really sort of more concrete skills that teachers or adults in school-based settings can put in place that have been shown to increase sense of belonging and connectedness with young people. And so, for example, if we click on this one here, showing students that teachers and school staff care about them as people and are interested in their well-being, we then have some really concrete example strategies that adults in school-based settings can put in place to foster this sense of connectedness, putting this skill into action. The other thing that's worth mentioning here is that we have, as much as possible, integrated an equity lens within these skills and concrete examples. So one example here would be ensuring that students feel they're being treated fairly. This is something that came up in the research literature as being really critical for students' sense of belonging. And so we include here some example concrete strategies that teachers or adults who are working with students can put in place to sort of check their own, often unintentional biases that might be threatening their ability to be fair to all students who they're working with, and give some really sort of, again, concrete examples of how adults can ensure that they're being fair in the way that they're interacting with young people. So that's just our really quick overview of the website. I do hope that you have the chance to check it out and find it helpful for the work that you do to support young people. Also would love to hear feedback. If you have ideas, things that could make this website stronger, additional things that we could do to help support school connectedness for young people, we'd love to hear that.
I know we have a packed agenda, so I'll be brief. I just wanted to share that at the CDC, we use this visual, which some of you are familiar with. It's the whole school, whole community, whole child framework. We call it WISC. And we use this really to help talk about the connections between student well-being and learning. It's a student-centered concept, and it emphasizes the role of the community in supporting the school and everybody in the school. And as you look at the graphic, you can quickly see some of the protective factors that Claire, Grace, and Natalie mentioned earlier, like positive social and emotional climate, family engagement, community involvement, and how these pieces together can help youth feeling safe, supported, engaged, challenged, and healthy. WISC doesn't have a last bell. We know these factors are going to be influencing students' well-being and their readiness to learn, whether it's 10 a.m., 4 p.m., or summertime. So even though you won't find the words OST written in the visual, I really hope you can see your work reflected. We know that schools and OST programs serve many of the same youth, and we know that it's about 8 million students and their families that are relying on after-school programs to find those safe, supportive, supervised places after school. And it's so much more than that. We know out-of-school time programs offer a space where they can explore interests, try new things, interact with their peers and trusted adults in ways that are really different from what they can do in school, making schools and out-of-school time settings such important complementary places to help beef up those protective factors. And that's one of the reasons we're so excited to partner with the EDC and NAA on this collaborative for advancing health equity and out-of-school times. Thanks.
Thank you so much, Sarah and Natalie. And we do have, there were at least one question that came up in the chat. And since we'd love to have a robust chat going throughout this, Natalie or Sarah, I'm wondering if you would mind responding in the chat to the question while we go ahead on to our next section. So I want to share this video with you that really, I think, illustrates this concept of thinking upstream, of thinking of how we can really look at the environment and what we're doing and how we can change and shape that. And so I'm going to just share this brief video, and then we'll have a little time to talk about it.
In a small fishing village, a group of folk gathered at the river. Not long after they got there, a child came floating down the rapids calling for help. One of the group on the shore quickly dived in and pulled the child out. But minutes later, another child came, and then another, and then many more children were coming down the river. Soon, everyone was diving in and dragging children to the shore, then jumping back in to save as many as they could. In the midst of all this frenzy, one of the group was seen walking away. Her colleagues were furious. How could she leave when there were so many children to save? Then, after long hours, to everyone's relief, the flow of children stopped, and the group could finally catch their breath. At that moment, their colleague came back. They turned on her and angrily shouted, "Hey, how could you walk off when we needed everyone here to save the children?" She replied, "It occurred to me that someone ought to go upstream and find out why so many kids were falling into the river. What I found is that the old wooden bridge had several planks missing, and when some children tried to jump over the gap, they couldn't make it and fell through into the river. So I got someone to fix the bridge."
All right, so I would love to have you share in the chat, or if you feel comfortable, you're welcome to come off of mute. First, just what was your reaction to that video as you were watching it? What were you thinking?
Hi, Claire Grace.
Hi.
This is Bianca. And one thing that I thought was interesting about the video is how the teammates turned on the colleague initially. And once the colleague explained what they were doing, it was kind of like like an aha moment. So I guess one of my first reactions is to just be mindful of some aha moments and be considerate of what your team members may view as solutions or supports.
Thanks, Bianca. Yeah, and please feel free to keep the responses coming in the chat. Yep, both need to happen, agreeing on the importance of being mindful of these. Thank you. And then I'm curious for you, I mean, this is different in every context. What kinds of things in your community are the kinds of things you see that are making kids fall into the river, that you're feeling like you're constantly trying to pluck them out one by one? What are the things in your setting that make kids fall into the river? And I know it takes a minute to articulate your thoughts in the chat. So I'll unveil our next question while folks are typing and thinking, which is, what are you doing to build the bridge where you live? And so we're getting lack of proactive planning among staff and parents, lack of parent care and involvement. Yep. So what else in your communities do you see that both makes kids fall into the river, or things that you're doing to repair the bridge? Yep, applying social emotional learning. What else? Building relationships with kids. Absolutely. We're going to talk a lot about that today. Well, I know, again, sometimes it takes a minute to kind of think what you want to think and get it typed up. So feel free to keep this conversation going in the chat. Supporting, and I'll just, educational gaps, supporting staff practice to build effective relationships, connecting with families, spending more time with kids. These are great. Keep them coming. And I'm going to just share, as I was pulling some of these images together, I love this one because I love this idea of, this way of illustrating that protective factors really buffer kids from a lot of these things. And we could have lots of things outside this circle, right? They've got challenges around anxiety and depression and the stress of studies and behavior problems and conflicts, substance misuse, but that these kids are inside, where we really look at the protective factors and we look at resilience. And, think of some of these things that we're talking about, really trying to build for them. And, our project in the Collaborative for Advancing Health Equity, we really look to see how programs can increase healthy activity, physical activity, and healthy eating, and to do all of this with an equity lens. And so these two in particular here, physical activity and proper nutrition, caught my eye because we really want to always be pointing people toward the National AfterSchool Association's healthy eating and physical activity standards. And just if you're not familiar with them, the NAA adopted the HEPA standards to provide practical, comprehensive guidance for out-of-school time programs. They address food and beverage, physical activity, content, quality, staff training, social supports, which includes staff role modeling, family engagement, children's social development, program support, environmental support. The first content area includes standards that really help translate nutrition and physical activity science. So again, evidence-based, we know the science is behind it. And then this guide really helps translate that into how can you actually do this, make this practical, adopt these standards for your program. It really translates into actions that OST programs can take to offer health promoting foods, beverages, physical activity, and then also has areas that with standards that address program and organizational policy, infrastructure, and reflect implementation, as well as health promotion science and management expertise. So if you are not already familiar with the NAA's HEPA standards, I definitely encourage you to take a look at them. And now I am so excited to hand it over to Rebecca Bishop.
Thank you, Claire Grace. I'm going to continue this theme that we've already heard, that around both the idea of increasing protective factors, but also that increasing protective factors promotes health equity. Also that increasing protective factors is a strengths-based approach, right? We want to continue to do that. But another way to apply this and think about this is if we look at this figure on the screen, we've all seen variations of this image to describe the concept of equity. But if we look at these boxes as protective factors, right? When we know young people that need support, if we shower them with the unique protective factors that they need to thrive, this will promote health equity, right? Next slide. I encourage you guys, as you guys leave this webinar and you're going to talk more about it, I encourage you to use that as a tool, right? To kind of bring this to other people. Sometimes it's hard to describe some of these things you hear. Claire Grace just showed us a video and one of the questions she asked was, what are some ways to repair a bridge? And I think this is a really nice illustration of ways to repair the bridge, right? This is a nice illustration of protective factors related to caring and supportive relationships from the Search Institute. And when we think about equity, we want to ensure that not just all youth benefit from protective factors, but we want to try to be strategic as adults, right? And there's a few things that we want to consider. We want to consider how our programs developing, for example, caring and supportive relationships with youth, right? Or you could apply this to protective factors. What strategies are we using, right? We know that intentionality is a key component of equity. How intentional are we being about this? We know that simply being in the space with young people is not necessarily a protective factor. It's about what we do with young people. How are protective factors interwoven throughout programming, right? Remembering that different young people will be involved in different aspects of programming. How do we ensure that we're doing this in an equitable way? The other element outside of programming that we want to consider here is we want to think about the young people themselves, right? And while we love these young people, we also know that they show up. They come from lots of different places, right? And may show up to us lots of different ways. How do you develop these protective factors when maybe there's young people that you don't know, that you're just building relationships with, right? Versus a young person that you knew from the previous year that you already have a relationship with. Consider behavior in our programming. There are some students that may act in a way that's disruptive. How are you managing that? How do you still ensure that those young people are getting access to the same level of protective factors in programming, right? Same goes for attendance. We know that students who show up, right, that's half of the job, versus students who might come once or twice a week. Same with participation. We have those who will raise their hand and constantly participate versus those who won't. So how are we kind of being strategic about our programming to ensure that all students are supported with these protective factors? And we know this is the hard work, but when we think about us as adults, this is the nuts and bolts, if you will, of thinking about how to bolster these protective factors. The third thing that I kind of want to talk about in relation to caring, supportive relationships and protective factors in general are ourselves, right? How does either the programming we provide or the young people we serve, how do they impact our perceptions, right? Of who deserves time, right? Versus who does not deserve time, or who deserves access to what protective factors versus who does not deserve access. We're all human, right? We know implicit bias happens as a normal part of our, or bias happens as a normal part of our brain, but how are we counteracting that intentionally? What work are we doing ourselves to ensure that we're providing equitable support, right? Equitable care to, both in our programming and to our young people. So if we're gonna kind of be comprehensive, it's essential that we look at these things. Next slide. Go up one. Yep, perfect. Continuing with some of these equity considerations, and some of these are repeated, but I think how they're framed could be helpful as we're applying this. What impacts how you increase protective factors for youth? So this is not necessarily the elements we talked about, but it's related. What impacts how you increase protective factors? What about when you don't have as much time in the day, right? You had a fire drill. There are maybe some other adults that are out and you have more kids than you expect, right? What are some plans that are in place to ensure that youth still have access to some protective factors throughout the day? And there are many other elements. And I encourage you guys, as I'm talking, feel free to put into the chat, what are you doing at your program, right? What considerations or what strategies are you putting in place to ensure that there's a mechanism so that these protective factors are built in, regardless of the how or what's going on? The other question, how does your program make decisions about service and leadership roles? It's really easy to pick the young people who are always standout.
Hey, what's up? I
Oh,
can't, I do not have a key.
So sorry if you're on mute, if you can mute yourselves, otherwise we hear you. So how does your program make decisions about service and leadership roles? Young people see this. How are we modeling this for young people, right? It's important that we know, regardless of any of those elements I talked about before on the previous slide, that all youth have access to that, because all of these things promote, we know, protective factors, right? And if, I don't know if folks are go ahead and writing in the chat, but what decisions, how do you guys make decisions? Are they transparent so that young people know how decisions are made? Is it a top-down approach where you're just telling young people what the decisions are? All of this impacts equitable considerations and overall culture of your program, right? And it contributes to, just as we heard from the data folks at the CDC, it contributes to not just belonging, it contributes to how fair young people feel things are. So, it's important that we consider them. The same thing goes when we think about participation and contribution. Who gets to participate and contribute? I think about young people who are not yet vocal. The young people who might not raise their hands, who might just go along with the crowd. How are we providing opportunities for them to show up in ways that are comfortable for them, right? To get access to the same set of those protective factors that the young person that's very outspoken is going to get. The other thing is, I think about opportunities. That young person who's right next to you, who always hears about opportunities, versus that young person that might not be the one to come and ask you, but is interested. How are we posting opportunities? Are you announcing it to the entire class or the entire group of your young people? So being strategic about these things are really important. And I see, Bria, I appreciate what you said. Talk to them individually, right? So what I like about that is your young people, right? Your group of students. There are some groups that you need to pull aside and talk to them and have the individual conversation. Versus there's other settings where you may be able to have a kind of just make an announcement. I think about my son's taekwondo class. It is a small, intimate setting where his sensei can just make an announcement to the whole class, but there's a culture in that space that says he can do that. Not all environments are not like that. The same goes with how do you engage and build relationships with young people? I think we mentioned this as well. Same with, again, examining your own unconscious bias. I'm just gonna look in the chat here. Yes, I hear will gain their confidence. If students have chronic absences, we will make them to-go bags for the activities. I love that, right? Because you're not stigmatizing them because they're out, but you acknowledge that whatever they have to do is also important, which really helps them understand that they're included there, which is great. I love that. And someone else is chiming in, agreeing with the individual piece. The direct contact that each student gets is important, which goes a long way with realizing that every student has different needs. So this final slide for me is really about taking action. If you wanted a cheat sheet for yourself or for your program, this is a great kind of way to think about it. You could do this daily, you could do this monthly, right? But having some mechanism to say, how are we doing? What are we looking at? Some mechanism to be intentional is essential. So assessing some of these elements we talked about, right? Who's speaking, being called on, who's given leadership opportunities, who was disciplined. We see this in disparity data all the time around students being disciplined with students versus students who are not. Let's turn that around to have that strength-based approach and think about protective factors there. Identify patterns. You may notice that you're calling on folks that may come from the similar areas, similar groups, right? We're gonna call out some of these protected, marginalized groups, right? If you find out that that's you, identify that pattern. It's the first part we know of mitigating implicit bias, identifying patterns. And then finally, find some professional development or support. This is really should be maintenance that we all use, be that trainings, social groups, any other groups that kind of support, examine our own bias, examine our own actions, or exploring engagement-based challenges on behavior or cognitive challenges. Hope this was helpful. Next, I'm going to go ahead and present some new presenters. I want to present Ken Anthony and Heather Williams. They are going to be sharing from the field, and we're so excited to have Ken Anthony from Connecticut Network for Children and Youth, and Heather Williams from the California AfterSchool Network. They both have made amazing, amazing contributions to the field through their work. And I'm gonna let them introduce themselves and tell you more about what they're doing and the publications that they have contributed to, but we're really happy to have them. Thank you.
Hey everyone, Ken, you want to introduce yourself first, and then I'll jump in.
Yeah. Hi everybody, my name is Dr. Ken Anthony. I'm the Associate Executive Director of the Connecticut Network for Children and Youth. I've been in the field, I was asked yesterday, about 32 years. So I've done everything from frontline staff to a site coordinator to a district coordinator. I've been doing this work with the network for the past 16 years now. So happy to be here today and can't wait to speak with you all. Heather?
Thanks. Hi everyone, Heather Williams. I'm the Director of Policy and Outreach with the California AfterSchool Network. Been in that role for about 5.5 years now, and been in the expanded learning OST field for 12 going on 13 years. And so I'm just gonna kick us off and share a little bit about some of our findings in California. And so there is some robust research about protective factors, and in 2019, we wanted to look specifically at protective factors in California for our youth and how after-school programs might be engaged in that or not. And so in 2019, you'll see this on the next slide, we partnered with WestEd. We commissioned this report about protective factors in California's programs. We pulled on data from the California Healthy Kids Survey, which is this statewide survey that we have that provides a lot of data, and there are questions in there about whether students are engaged in after-school programs. And so we were able to look at data, and I'll share some of these findings pretty briefly. So I'm going to run through the next couple slides quickly because we've been talking about protective factors all morning. But just highlighting, so in our report in particular, we focused on 3 large areas of environmental support. So caring relationships, just noting, even one single positive, trusting relationship with an adult makes a significant difference in children's lives. High expectations and meaningful opportunities for participation and contribution. And so there's a lot of different protective factors that we talk about, but in particular for this report, those were the 3 broad areas we looked at. And then if we continue on to the next slide, this just talks a little bit about, these, whether they're present in family, schools, communities, or after school programs. They're really important to foster resilience and positive youth development. And so on the next slide, we basically say if these are in place, then our students feel connected, they develop SEL competencies and other personal assets, and they avoid engagement in risky behaviors. And so basically our findings supported what all the research says at the national level, just specifically in California, that our extensive system of programs is having a positive impact on our students and supporting protective factors within our students. And so while there was good evidence, in particular in our study, we found there was evidence supporting high school programs. And so this was really important to us because a lot of times when we look at a school time and after school and expanded learning programs, a lot of the investment is put into supporting students in, elementary school, middle school, and those are important developmental times. But the impacts were actually the strongest with high school students. And so giving us some data to talk about the importance of not just dropping off programs when kids move into upper grades, but the importance of continuing to invest in these programs as students go on into high school. So moving on to the next slide. So this just highlights, and I'm not going to read all of these, but a couple of the key findings. So basically, we found that students who attended after-school programs reported significantly higher levels of participation in school compared to those who don't. And so this in particular has been really important as we're talking about chronic absenteeism and how do we re-engage students in schools. And so we have used this data point in particular to kind of make the argument that if we are able to engage students in after-school programs, they're more likely to engage in the school day. And so we are a strategy just in and of ourselves to address chronic absenteeism and student engagement. And then the next finding talks about, again, reporting significantly higher levels of school connectedness, academic motivation. And so that was tied to caring adult relationships, high expectations. Again, all the specific data is there. I'm not going to go into the details of that. And then the next finding, we basically, in California, we're really fortunate. We have a significant investment of state dollars into our expanded learning infrastructure. Along with that, we have our quality standards for expanded learning in California. So one of the key findings was that it's not just having a program in place that was important, but having high quality programs tied to these quality standards in this robust infrastructure was really important to support positive youth development and these findings. And then I think we have, one more high school student. So as I said at the start, the difference between participants and non-participants was the greatest basically when we looked at high school students that were engaged. And so again, this data has been really important to us since that time to argue for the importance of continuing to support our high school students, right? Like we don't want these opportunities to drop off just because our students go into high school. And so I think I have a couple more slides and then I'm going to turn it over to Ken. So, and this is important because we all know early childhood is a critical period of development, but a lot of research, right? Science of learning and development, a lot of other things have been coming out to really elevate the important developmental time of adolescence. And so our report on protective factors also kind of elevates the importance of providing those protective factors in this critical period of development for our youth. And so really wanting to focus on, again, not just our youngest kids, but how do our kids all in all ages and in particular high school, how do we support them as well? We really are trying to lean on protective factors versus risk factors, positive youth development, et cetera. And then we also really wanted to look at how do we partner with communities to amplify the support of protective factors. And so this isn't just the role of at a school time alone or school day alone or individuals alone, but how do we work in partnership? And we're going to talk a little bit more about this in a minute. Ken's actually going to dig into this because this is a lot of what our brief was on. But I think the last slide I have, the next one, just to kind of get us going into this conversation, is looking at this collaboration continuum. And so again, won't go through all of this, but I think this is really important as we think about collaboration and partnership. Sometimes we say we're collaborating with someone, but really we're just networking. Maybe we're coordinating if we're lucky. And so as we think about different levels of partnership, what does it truly mean to actually collaborate with one another, to collaborate with within the out of school time community, but within larger communities as well, to think about how we build these partnerships. And so with that, I'm going to turn it over to Ken for.
And Heather, if you don't mind, this is Claire Grace. I just thought right super quick in the context of the moment, and we'll hold other questions to the end. Somebody just wanted to know what ages are included under early childhood in your previous slide.
That was just a broad reference to early childhood. It's not a specific age. You know, there's a lot of research generally about the importance of early childhood development. So that was a broad reference, not to any specific age group.
Great. Thank you so much.
Great. Thanks, Heather. So just to give you a little background about the brief that Heather and I put together. We started writing this in 2022 as the pandemic was sort of in its I guess its crest. And this was a companion piece that we wrote to accompany a brief in 2021 by Dr. Terry Peterson and Dr. Deborah Vandell. And here's a link in the chat for that report from them. But really what we were trying to do was look at the evidence base of after school, out of school, and summer learning to figure out how can we best leverage our BESSER funds at the time to be able to enable districts to build better community partners with a research base with the evidence base. The one that Terry Peterson and Deborah Vandell put out was called the Evidence Base for Summer Enrichment and Comprehensive After School Opportunities. As part of this, we're grateful for the support of the CS Mott Foundation and the 50 state network that both Heather and I are a part of. Next slide, please. So what can communities do to amplify efforts to support the protective factors? Well, first, by creating intentional partnerships, can boost impact by addressing the protective factors from a holistic perspective. This comes with establishing a sense of partnership, and it's contingent on perceptions of reliability, trust, joint planning, and information dissemination, as well as sharing between community-based organizations, school districts, and cross-sector partners that support families and children. The depth and scope of these relationships between these partners begin with trust and integrity between the school and after-school program. Without trust, you don't have anything else. Next slide, please. So research shows that after-school staff not only are more likely to represent the diversity of the student population they serve, but typically come directly from the communities they're working in. They're often run by community-based organizations that are responsive to the unique needs of the community. The relationships of the students, families, and communities extend well beyond the 3 hours of dedicated after-school hours per day, resulting in more stronger, trusting relationships. Really goes back to what Heather said about that one-to-one connection. That one caring adult makes all the difference. And this sets a solid foundation for our after-school and summer programs to serve as a hub within the community. Next slide, please. However, the reality in many communities is that school after-school partnerships are more often promoted or included in grant proposals than fully realized. School leaders agree that after-school programming is important, even as they discount its worth by treating it as an entirely separate entity from the school sometimes. Meanwhile, after-school program leaders may be pulled in different directions. Developing a full and sustainable partnership is kind of difficult with schools because there's so much going on. But getting into alignment is a bi-directional relationship. As you can see from the framework here in the QR code, this is a framework from Tracy Bennett and myself. Tracy Bennett formed it in 2015, and I refined it with my doctoral work in 2016 to really encompass these three parts around communication, sense of partnership, and academic resource sharing. And when we talk about resource, we're not talking money, we're talking curriculum, websites, etc. Next slide, please. So creating a sense of community between partners, between the school and after school program has innumerable benefits. I spent my career thinking about, writing about, researching about partnerships and how to make them better. And what Tracy found in her research in 2015 in California, and she had a pretty good sample size, was that when there's a sense of partnership between the school and after school program, kids do better on their standardized tests. Conversely, when there's little sense of partnership, there's this disconnection happens, there's actually a decrease in their test scores. So creating the points of connection that support evidence-based practices can help with the pervasive disconnection that often impedes successful partnerships and prevent that full actualization of the protective factors within the communities that are served. It takes intentionality to make these things happen. Next slide, please. So we must consider, what are the conditions of the system that allow for these unique and innovative child-serving solutions? How do we nurture these conditions in other places? How do we provide support and resources beyond just dollars so that we're not only meeting the most immediate needs, but simultaneously reimagining the systems that support children and youth? Ensure collaboration, not only within the systems, but advocating for intentional partnerships that create this web of supports beyond the school, after school, really looking at the full community breadth and address the inequities that pervade these systems, creating opportunities for growth and development that encompass a comprehensive strategy for implementing practices that amplify the protective factors. Next slide, please. The template in the QR code provides a good starting point for considering partnerships to enhance, expand, or rethink what you're currently doing. It includes categories that Heather talked about before: the caring relationships, the high expectations, the meaningful opportunities for participation and contribution. You can use this template as a resource for mapping your current partnerships, kind of figure out where you want to go and where you have to go to get the community to help identify these gaps and opportunities. Next slide, please. So how do we build these lasting collaborative partnerships? All this stuff sounds great. Sounds like, yes, we can do this. But how do we do it? Next slide, please. Are there connections that are already established? Is there a willingness? And the most important part, that willingness of both to be a partner, not just to sign off on my grant, but an actual true partner. Is there trust between each party? You may have heard the Stephen Covey quote, which is, relationships move at the speed of trust. Without it, you aren't going anywhere fast. It takes trust. It takes okay, you're not going to eat the brownies, steal the erasers. You're not going to kick us out of the gym. It takes a bi-directional relationships. So thinking about why partner, what do they offer as a partner? Is there the capacity to nurture and grow these partnerships into bigger and better things? And how can it be prioritized as something that is not a nice to have, but a have to have? Next slide, please. One of the steps is to create a clear memorandum of agreement or a memorandum of understanding that each party agrees on. Spelled out crystal clear. Here's what we're going to do. Here's what we're going to do. Here's how it's going to work. Establish ongoing and regular communication. Don't just sign the paper once and say, okay, well, we're good to go. Have that ongoing communication. Know what the goal of the partnership is, and that is in line with the organizational mission. Mission creep, mission mismatch definitely has impacts on partnerships. formally acknowledge the partnership. And this may be just an announcement, this may be a press release, something else, but be proud of the partners that you have and acknowledge that. And get a written commitment that they're going to be a partner, not just for the grant period, but maybe for the longer haul. Next slide, please. So one story that I have here from New Britain, Connecticut. It's a small post-industrial town, about 70,000 people. And what they have is the the Coalition for New Britain's Youth, which over the past 12 years or so, the district community partners have developed an award-winning summer program where they recruit kids and they say, instead of, hey, you have to go to summer school, it's congratulations, you're going to the summer enrichment experience. And they had a pilot with about maybe 100, 200 kids. Now they're up to over 700 to 1,000 kids per summer. They have had awards from the grade level reading campaign and others recognizing their efforts. But the one thing that really sticks to me is that when I talk to the kids and the families in the program, they say, I get woken up at 7 o'clock every morning to get to this program. It's the middle of summer. Kids want to be there. They want to be there because they have that relationship, because they have that connection with the program. But instead of focusing solely on academic outcomes, the planning team, which begins meeting about 2 weeks after the summer closes, so they meet right in September, intentionally develops strategies and programs that support and enhance the protective factors, not just from the school side, but from the community side. And they come together co-teaching a model. So morning to afternoon, when you have a content area, you have a certified staff and a community-based staff co-teaching together in that classroom. So you're really reinforcing not just the school aspect, but the community aspect. It's been an evolutionary process as the community learns together. They improve it every year. This year's iteration, I don't know what it's going to look like, but I'm sure it's going to be something fantastic. Really taking that intentionality, thinking about your partnerships and how can you remake and rethink the systems you have to build in these protective factors as a web is really critical. I'm going to turn it back over to Heather for her story from Sacramento.
Thanks, Ken. So yeah, another example of what this looks like in action. This is in the brief, so you can read more about it in there as well. And of course, when Ken and I were working on this, we were really like in the height of COVID. So this particular story is a little COVID specific, but I think it still highlights the importance of these relationships. And so as we know, with school closures, this impacted everybody's mental health. It definitely impacted student mental health. And so this is a small town in the greater Sacramento region, and this student was in particular really struggling, having a lot of challenges and actually expressing suicidal ideation. And so the parent of the child actually had a really good relationship with the expanded learning site coordinator and was able to reach out to the staff person and talk to them about what was going on. And they had that site coordinator had a really strong relationship with the child, right? One caring adult, the importance of that. And so the site coordinator, our site coordinators are amazing, but that is a lot to take on. And so they were in partnership with the school counselor. And so even though the school was technically closed, the counselor was not on duty when they found out about this, the site coordinator still had really built up those relationships so that they could reach out to them out of hours. The school counselor was able to unlock the mental health services and get the youth the support they needed. And as the quote at the end says, mental health does not take a vacation. And so truly having that strong, caring adult relationship allowed for those factors to be in place and those partnerships to be in place to support this child in that moment of crisis. And so really the importance of building those relationships was critical in this case. And so the last part of our presentation, we actually in our brief made recommendations for folks, practitioners, researchers, and policymakers in terms of like what to think about in terms of building these relationships. And so if we go down a couple of slides, we'll just wrap up by sharing some of these recommendations. So I'll start with the practitioners. We have 4 key recommendations for practitioners, and I think there's a lot of those folks on today. And even though, again, some of this was written in height of COVID, it still remains very relevant. But for our practitioners to recognize the unique set of assets and expertise you bring to the table, I think sometimes in out of school time, we can kind of be brushed off to the side, but we know our role as practitioners, we do bring a lot to the table. And so recognizing that ourselves and being very clear about what we bring to the table. Also remaining committed to the core tenets of positive youth development and student success, providing safe, calm, predictable environments for youth, et cetera. And so this is what we specialize in out of school time, positive youth development. And so it's really critical that no matter the crisis, no matter what we're navigating, that we remain committed to that. And then on the next slide, we have our last 2 for practitioners. Make sure you are at the table. So this cross collaboration, this partnership we've been talking about doesn't happen if you're not in the room when decisions are being made. And so I know in California, we've navigated this for a long time, like, oh, we're great. Like people should come talk to us and partner with us, but really we needed to go and be in spaces if there wasn't a seat at the table for us, make sure that we create that spot. And so really making sure we were in the spaces and again, being really clear about the assets we bring to the table. And so this needs to happen at all levels of the ecosystem, local, state, and national. And then build and leverage partnerships. And then I'm going to turn it over to Ken for our researcher recommendations.
Okay. So for recommendations that we covered for researchers, the first thing was to develop research practice partnerships that can identify and amplify practices to better support children, families, and communities. And that could be a cohort-based model. That could be, really community-based research, but trying to dig into how can we better support this through out-of-school time programming. Working cross-sector to develop partnerships, identify more than the usual suspects. We all know who's sitting around the table usually. Think about who's not at the table and build a table, as Heather said, that includes all voices that impact the lives of children and families. And finally, know your local champions. And if there are none, begin to cultivate partnerships that can grow future champions. Champions are so critical to really moving the work forward, to being able to advocate for what you're doing, to explain, here's what we do after school. Here's what we do in the summer. Here's what out of school time is. So being able to grow and know those champions. So with that, I will turn it back over to Claire Grace. And thank you so much for having us today.
Thank you so much, Ken and Heather. I cannot believe how much great information and tips and concrete actionable things that you packed into like 25 minutes. This was so great. Thank you so much. I'm going to give just a minute. We don't have any questions in the chat yet, but I'll give a minute to see if anyone does have a question. If you want to post it in the chat. We got one from Steve. What are the next steps for this work and how do we continue to broaden the conversation?
It's a great question. I'm like, well, we already did a presentation at NAA, keep going, show on the road is the best way to do it. I mean, just, talk to folks, just keep talking about this and amplify, objective factors. When I first heard of them in, I think it was 2010, I was like, where's that curriculum? Where's that? Let me see that. How do I do this? And folks are like, no, it's not a curriculum. It's a concept. Oh, okay. Well, wrap your head around that. So I think that's one of the first things is to really explain what are these things, because it's common. You're doing these things already. It's really just amplifying and lifting them up, I think. Heather, you have anything?
Not much more to add to that. I think, we look at things just as you were saying, like awareness. So first you start with building awareness, and that's part of what we're doing, right? Helping build awareness, then thinking about the application, then building mastery. So I do think building just awareness, a lot of our folks in out of school time, they might know some of this or might kind of loosely be aware of this, but making sure that our own staff, our own field is well versed in being able to talk about the fact that this is the work we do, this is the impact that we have, and that gives us the leverage to then, you know, when we sit at these tables and have these conversations and build these partnerships, we're not coming to the table and asking for handouts. We're really coming with like, these are the assets we bring, and this is how we can partner to support our youth and our communities. And I think that's really essential to build the capacity of our field to have those conversations, to then in turn build those relationships.
Thank you. And I just wanted to share, Nettie shared this great example of partnership from Franklin County, Ohio, the Equity Center Social Emotional Learning Collaborative for out-of-school time programs. Since 2010, they've had a five funder partnership between the city and the county, 3 funders, 3,500 youth. They engage parents and caregivers. And one of their former summer day camp youth from the Paragon Project tried out for American Idol, and they put the clip in there if anyone would like to navigate that after the webinar to watch it. So thanks for sharing that, Nettie. And then Natalie shared another tool from the CDC, and we're gonna I'm just want to make sure that we have time. So if maybe you want to give your like super quick snapshot answer to Sarah's question, what have you found to help with sustaining these partnerships in a workforce that's known for high levels of turnover? So incredibly complicated, pervasive challenge in the field that I'd love to hear your just quick take on that.
I can give a quick 2-second take
Perfect.
on it. We have developed cohorts here with after-school professionals that are leading programs. Leadership tends to stick a little bit longer, and being able to support them for a multi-year cohort around social emotional learning, protective factors, and all of that. So we're in our 3rd or 4th iteration of that cohort now.
Great.
Yeah, and I think just looking at, right, why do we have such high turnover? There's a lot of reasons. And so we're doing a lot of work in California about like, what are the pathways into, within, and beyond expanded learning? And so if we have that pipeline, like how do we acknowledge some folks will turn over, but we can actually build a stronger pipeline of workforce that will be in the field a lot longer. And so we're not just accepting that our field will forever have high turnover. We're trying to really address that and take that on.
So building the bridge, that's what this is all about, right? Let's go upstream and figure out how to get ahead of it and look at the pipeline. Thank you so much. I wanted us to have an opportunity to really think about how we kind of bring all of this that we've talked about together. And so we have a case study that I'm going to read, and I would love to have everyone, just to begin with, just be listening. You might want like a quick piece of scratch paper or take a note on your phone. But as I'm reading the case study about Nina, would love to have you just jot down some notes to yourself, listening for risk factors in this person's life, listening for where you hear some protective factors, and also where you hear in this story that there might have been some missed opportunities to offer some additional support, or to have added some additional protective factors that maybe that opportunity was missed. And we also are putting a link. Oh, thanks, Kate. If it's easier for you to read instead of hearing me just verbally read it out loud, we have also put a link in the chat if you want to navigate to that. And I'm going to go ahead and read it. So Nina is 11 years old. She's in the 5th grade. She lives in a 2-family house with her 2 moms upstairs and 1 set of her grandparents downstairs. Her grandparents do not speak English. Their neighborhood is very economically depressed. The few convenience stores there are all lock up early, and the nearest grocery store is a 40-minute bus ride away. Her grandmother pays the expense of a taxi once per week to go to the grocery store because she's not able to carry all of her grocery bags on the bus, but she thinks it's important that her family has lots of fresh fruits and vegetables and that they eat meals from their culture to nourish their bodies and their spirits. Nina's parents both work full-time, and with commuting to and from work on public transportation, they're gone long hours, and Nina's grandmother takes care of her in the mornings and afternoons. Despite their long days, when Nina's parents come home, they prioritize spending time together as a family. They walk to the public library, the park where they kick a ball around or play tag. the playground equipment is broken and unsafe, or they just stay home playing board games. In second grade, a teacher at school noticed Nina was not fully engaged and noted that she daydreamed out the window most days. Her participation in class was minimal, and the teacher contacted her parents to discuss her concerns. She felt that Nina was just not paying attention. In fourth grade, Nina fell behind academically. The girls in her class made fun of her clothes since they were not on label, and her teacher became frustrated with her performance and lack of effort. She knew she was smart, but felt she just wasn't trying. Nina did love playing in the school band, however, and she loved going to schools on days when she had band practice. At the beginning of fifth grade, Nina began getting into arguments with a group of girls. After a few months, her grandmother was not able to get her to go to school in the mornings, and she had 18 absences. A truancy officer was sent to the house, and her parents were told they must do everything in their power to get Nina to school or they would risk criminal prosecution. A wraparound coordinator who had recently been hired at the school from a grant suggested that maybe Nina would benefit from the before and after school program. They'd recently started a music club and a hip hop dance group as part of this after school program, and she thought it might motivate Nina to attend and be a way for her to not only make new friends, but also ensure that she was getting to school on time. Her parents said they couldn't afford to pay for the program, but the coordinator assured them that they had grant funding they could use so that Nina could attend for free. Nina reluctantly agreed to try the program. She did like the idea of getting to play music and to dance. She didn't love that she was one of the oldest kids there. She also disliked the circle time that started the morning and afternoon and the rotating activities at tables that happened when it wasn't club time. They were boring, and she had to sit quietly and was not allowed to get up and move around. And it felt like everyone in the program already knew each other and raced to activity tables to save seats for each other, and she was left to wander around figuring out where there was an open seat. A few weeks ago, a staff member chided her for still being up and walking around the tables when everyone else was already started an activity. She told her that because she was up and walking around when she was supposed to be sitting working at a table, she was going to mark her down on her chart for the day. Each day, the staff used a poster on the wall to give X's or stars for how the day went for each child. Recently, Chris, a staff member at the before and after school program, noticed that Nina was standing alone while the other kids were starting activities. She told Nina that she could really use some help checking that each of the tables had the supplies they needed and asked if she could help by going around to each table and seeing if they needed any of their activity supplies refilled. She also allowed her to go into the supply cabinet, which usually was only allowed for staff to get the needed supplies and refill them for each table. The kids in the program loved that Nina could come over to their tables and ask what they needed and bring it for them instead of having to wait with their hands raised for staff to come to them. They also found out Nina had some great creative ideas, and they started asking her to share her ideas for how they could use the activity materials and wanted to show her their projects, even the older kids. Chris was excited to tell Nina's grandmother at pickup about how great Nina was doing, but there was a huge language barrier. Her grandmother just nodded and smiled when she tried to tell her about Nina's day, and Chris wasn't sure how much she understood. She wanted to find out more about how things were going for Nina at home and at school so she could best help Nina to feel connected. She left messages for Nina's parents at work, but it was difficult to connect with them because they always called back in the evenings when Chris had already turned her work phone off for the night. Nina's attendance at school has improved, and she's becoming more engaged in the before and after school program and starting to make friends. But Chris is wondering what more they can do to help Nina to be happy, healthy, and successful. So you just heard a lot about Nina. And I would love to have you now share your thoughts. What are some of the risk factors that you heard in the story? What are some of the things that jumped out to you as far as some of the when you think of that scale, some of the risk factors that might be kind of tipping things for Nina? Low income. Thank you, Christy. Family language barriers. Lack of communication, bullying. Yep. Anything else that you heard? Maybe some individual factors I was thinking too when they talked about her having a hard time paying attention, daydreaming out the window. Yep, access to healthy food, lack of meaningful opportunities, low income and bullying. Great. All of these, right? So how about what were some of the protective factors that you heard? What are some of the things that jumped out at you in the story that functioned as protective factors? The grandmother's commitment to healthy eating and cultural food. Yep. Staff person that saw her potential, family connection. We heard this story and there were a lot of risk factors we could hear, but I'm like so excited at how quick some of these protective factors are now popping up in the chat. Family connection, family support. What else? The grandmother, yep, spending family time, having close ties to family. Their OST program. We should all be reacting and adding thumbs up to that. Absolutely. Youth that looked up to her, protective factor with her parents, the playground, the library. Absolutely. Having funding for the OST program. I mean, being able to have a grant that can support attendance. Absolutely. Appealing to her interests in music and dance. Yeah. Were there any places that you saw missed opportunities in this story? I mean, we can see that there were lots of protective factors that, were helping to tip the scales for Nina, but anything that you heard in that kind of made a light bulb go off of like, oh, here was an opportunity that there could have been some additional support or some opportunity and increase these protective factors. So seeking to repair the community, the check mark box for the day, not cool. Yep. So how are children being encouraged to try new skills or to work on behaviors that might feel challenging at the moment to, help students to be redirected in a way that feels really positive and strengths-based? Missed opportunities. Yep. Oh, something like gardening or gardening with the grandmother. Yeah. Great. Absolutely. Different connection to cultural groups. Yeah. Absolutely. And so just before we kind of move on to, we really want an opportunity to share some additional resources with you and a couple more things before we get to the close here. And so I just wanted to know, showcasing music performances and abilities. Love that. Anything else that you just want to share in the chat? Anything else that jumped out from the story? Anything that you feel like you might want to take away from listening to this case study and maybe an aha moment that it might have popped up for you? Anything else you'd like to share in the chat? Well, feel free to keep the chat coming and keep the conversation going, but I am going to go ahead and hand it over to Bianca to bring it home for us.
Hello, everyone. Thank you so much for spending time with us. We know 90 minutes is a long time, so we appreciate your patience, and we also appreciate your attention and rich conversations that have been happening in the chat. Some additional resources that we would just like to acknowledge. We have some great content from Head Start Early Learning and Knowledge Center, AfterSchool Alliance, CDC, and the Wallace Foundation. All resources will be available in our follow-up communication, which will include the slides to this presentation and recording. Additionally, we would like to acknowledge that our assessment to action is available. This is a really great self-assessment tool to be used when figuring out how do I have high quality out of school time programming. And so this is an assessment that was created by our collaborative, and again, is available to everyone for free to utilize and to really take some time to think about what are the other ways or other things that we can be doing to enhance our programming. Additionally, we love to hear your thoughts and your feedback. So if you have time, please take a moment to fill out our feedback poll where we get a chance to learn not only your thoughts, but it's also a chance for us to grow and to enhance our learning series and resources. So please take some time to complete the poll. I see we have a little over 50 folks still here with us today. So hopefully we will get some more responses. So far we have 3 responses in this poll. Again, it doesn't take long. We just want to make sure that we have some time to know your thoughts and get some feedback from folks. So I'll give folks about another minute or so, so we can get those responses up. So far, we have 12, 13, 14 responses, 15. All right, all right. Now we're up to 39% with 17 participants. So again, thank you. The feedback is a poll. So it is a poll that should be presented directly in front of your screen. So please let us know if you do not see the poll. Again, thank you all so much for completing this poll. Again, we want to make sure we hear from everyone. So thank you for your feedback in the chat. And we also appreciate your feedback in the poll as well. So before we head off into the rest of our days, we want to make sure we take some time to acknowledge what are some things that we can do moving forward. What is our commitment to action? So really take some time to reflect and think about what is something that I can do tomorrow, next week, and next month. Whether it is reaching back out to our team for some technical assistance, reviewing some of the content that has been shared, and making sure that we also take some time to review the resources that have been presented to us. So really take some time to think about what can you do in the near future, short-term future, and full future that you would like to commit to. Please feel free to share in the chat what are some great things that you will be doing moving forward. And last, but certainly not least, we always love to hear from our audience members. So one thing that we would love for folks to do is to complete our year 24 PD survey. This is a super important survey for us for our program. This is a really great opportunity to hear from folks from the field, hear about some promising practices that are taking place, and what supports will be beneficial to your work. We will be asking for the feedback by June 7th. It takes about 10 minutes to complete, provides time for reflections, and informs about our future activities and ways that you can be a part of those future activities as well. So please feel free to select the link that has been entered into the chat or use the QR code that is presented on the screen to complete the survey. This is something that's incredibly important to us, and we'd love to hear your feedback. And of course, we have some really other great resources that we like to share with folks. You can visit our webpage on the NAA website, National After School Association. That would be a great resource for folks to utilize. Select the Collaborative for Advancing Health Equity and OST, and you will be able to see our resources, past content, and additional information to support your OST endeavors. And of course, thank you again for your time. We greatly appreciate your participation, your patience, your flexibility, and your feedback. It was a rich conversation in the chat. Thank you so much to our presenters. Thank you so much to Claire Grace, Kate, and Rebecca Bishop. Will we get a certificate for this webinar? No, but if you do need to have verification that you have completed this webinar, please let us know, and we'll be happy to provide that information for you or for your organization. So again, thank you all so much for your time. A recording will be shared with folks, including all resources that were mentioned. Have a great rest of your day and have a safe rest of your week. Thank you, everyone. Thank you, Linda. Thank you, Natalie. Thank you, Evelyn. Really appreciate you. Oh, thank you, Maddie. Thank you. Thank you. And we also do have a question in the chat from Philip. If anyone is receiving federal funding for an OST program and would like to learn more about a project, let him know. Information is in the chat. Again, thank you all so much. Thank you, Wanda. Thank you, Sarah. Really appreciate your time and your expertise. Thank you, Nicholas. And thank you, Leanne, as well. And at this time, I think we are going to close out our session. Really appreciate everyone. Thank you.